So meet Michael. He was a motorcycle rider. He's got blood coming from his mouth.
Ow! Sorry, mate.
How are we going on with the EFAS? He's had a pretty big accident. Potentially got a bleed on the brain. Why he's so tachycardic? Could do with a bit of help, yeah. All right, buddy. All right, buddy. This is the worst trauma I've had to deal with.
Room I've been receiving.
A serious case is coming in.
We've got an 18-year-old male who's been tackled playing rugby. Immediately complaining of severe chest and neck pain. He's having some periods of apnea lasting up to a minute at times.
You'll do primary, you'll do procedures. So we've got anaesthetics.
Dr. Jonathan prepares for the worst.
Neck pain, strange breathing pattern.
Spinal cord injury.
So I guess that's what we're getting at, isn't it? We've just heard there's a patient coming into trauma 2. He's been involved in a rugby tackle and he's collapsed and he's had an issue with his breathing. And all that to me makes me worry, has he got a spinal injury?
I believe they're on their way.
Paramedics arrive with 18-year-old Katu, who has breathing difficulties and severe back and chest pain after collapsing at a school rugby league tournament.
There we go.
Is this the rugby gentleman? Yeah. And he's breathing now?
Yeah, bit of an unusual presentation.
Why don't we come on in, get him across, give us a handover, we'll do a primary survey and we'll go from there. So suspected spinal injury, just be careful.
On 3, guys. 1, 2, 3.
This is Katu. He's been tackled to the ground. He has had severe chest pain, midline neck pain, and he's then had a couple of episodes of apnea at a couple of stages. His friends have done CPR on him.
Stopped breathing and they've done some CPR.
Yeah.
Whenever we hear that someone's not breathing or had periods of stopping breathing, that's an absolute emergency. Is he breathing normally? How are you feeling there, mate? Where does it hurt?
Equal.
Chest. Is it in the front of your chest or in the back of your chest? Front of your chest. I'll echo him and have a look.
Dr. Jonathan must quickly decide if they need to take over Katu's breathing.
What time was the accident?
About an hour ago.
An hour ago, yeah. But he's breathing too quick. There's no pneumothorax on the left. Lungs look okay and his abdomen looks okay. I don't see any injury to his abdominal organs.
Katu may have struck his head when he collapsed on the field.
Do you want to do a neuro assessment, find the level?
Yeah.
He's moaning, right? Is he actually compos mentis or what's the neuro?
I've had conversation with him.
Yeah, okay.
Squeeze my fingers in this hand. Squeeze your right hand. Squeeze, squeeze, squeeze. Pull this left arm towards you as far as you can. His upper limbs have got more power than his lower limbs.
What are his pupils doing? Are they equal? Or?
So the pupils are reactive.
There was back pain and neck pain and chest pain. So chest x-ray will help me have a look at the ribs and again at the lungs.
X-ray when you're ready.
And he's collapsed on the ground. He's been in rugby, so we'll have a look at his pelvis as well. Yep, I do. Great. That's perfect, thank you. All right, so the x-ray is normal.
Katu's dad was at work when he got the call that no parent wants to receive.
When you get a phone call and you got to go home because your son's in an ambulance, your heart just sinks. He's normally pretty healthy, no dramas. This is nuts, it's just shock.
Katu stopped breathing and needed CPR on the field. An ECG will reveal any immediate heart problems.
That's beautiful, that's fine. So chest x-ray is normal, his pelvis x-ray is normal, his ultrasound's normal. So far, all normal. So what's going on? Does he have a spinal injury? Is there something else? It's not really clear yet.
Focus on your breathing, okay, and not to move your mouth.
Dr. Papson must solve 2 problems. Why did Katu lose consciousness? And why is he having difficulty breathing?
Very worried about this boy. I'm worried he's broken his neck sort of about here somewhere. That's what I think it is. There's a chance of paraplegia, there's a chance of quadriplegia, so all your legs and your arms not working properly also means that you don't breathe properly, and that's an awful way to be.
Emergency Registrar Dr. Terry Kane from the UK has only been working at the Royal Melbourne Hospital for a few months.
I moved to Australia mostly on a whim. Came here for 1 year, 1 year's become 4 or 5, and I'm a permanent resident, and now you guys can't kick me out. When I first applied for medicine, I actually wanted to be a child psychiatrist, and the more medicine I did, I realized I liked to be a generalist. I kind of fell into emergency medicine. It was terrifying at first, but the more comfortable you get with it, the more interesting it becomes. I really enjoy it.
2 broken arms. Not a good day for him.
Okay.
Dr. Terry prepares for his first case of the day.
We've got the trauma imminently coming in. We're just looking for mobile X-ray to come to trauma 2.
Paramedics have rushed in 24-year-old forklift driver Michael, who has multiple injuries after his motorbike slammed into a van.
If he's stable, let's transfer, then we'll do a proper handover.
Let's do that. 1, 2, 3. Everybody, so meet Michael. He was a motorcycle rider and he had a helmet on. He was seen to drive into the side of a minivan at quite high speed. We think between 60 and 80 kilometres per hour. Just complaining of severe pain in both of his wrists.
Okay.
Where he's got a bunch of missing teeth and blood coming from his mouth.
Okay.
He had a compound fracture to the left forearm and an angulated fracture of his right forearm. What's going on?
He's had a pretty big accident. He could have some quite life-threatening injuries. The fact that he's confused is never a good thing. It means that he's potentially got a bleed on the brain, and we don't know the extent of that.
Ow! Sorry, mate.
So there's blood coming from his left forearm.
But they didn't report significant blood loss.
No, they did not. Why he's so tachycardic. He's tachycardic, so his heart rate is high. It's an indication that you could be bleeding from somewhere and your heart's trying to pump faster because your body's not getting the blood.
Uncovering what's making Michael's heart race could save his life.
He's on a ketamine infusion, which also drives up your heart rate. So it's probably going to be multifactorial. There is a question of blood loss, but I'm just waiting for more investigations first. How are we going on with the EFAS?
His lung slide present bilaterally.
And nothing in the tummy?
Yeah, everything looked okay.
Perfect, all right. His EFAS is negative, so it shows that his lungs are expanding appropriately. There's no blood around the heart, and there's also no blood in the abdomen. All right, we're about to do X-rays. Everyone not wearing lead. You want to head out? Great news from the ultrasound, but it might be a different story with the X-rays. Everyone in there is wearing lead, yeah?
X-ray.
Does it show up on here?
Pelvic fractures.
Pelvic fractures? Ooh. X-ray of his pelvis, which looked like he's got a couple broken bones there, which can be life-threatening because you can bleed out liters from your pelvis. That's his forearm? Left forearm? Yeah, there you go. That's his right? Just there then, yeah, cool, all right.
An open on the left and a
Closed on the right, yep. Broken bones in both of his forearms and wrists. Both sides he could lose function from his arteries and nerves. They are such horrible injuries.
Oh,
We could probably give him some fentanyl as well. He's got multiple pelvic fractures, yeah. So fentanyl would be great for him. This is the worst trauma I've had to deal with. I'm very concerned about Michael's condition. Hey, Michael.
what happened?
Do you remember coming off your motorbike?
No.
Is there anyone you want us to call? Your mum? We'll see if we can give her a call, let her know what's going on, all right?
Michael lives with his mum, Michelle, who's been contacted to come in straight away. Emergency nurse Chelsea Jones gets him ready for a CT scan that will reveal how badly Michael is injured.
And I'm going to need to take your piercings out.
He's got ketamine in him. He's not going to know what to do.
What happened?
You're in a motorbike accident, darling.
What the
Michael's forgetfulness could be post-traumatic amnesia, concussion, or he could have a bleed in his brain, which is very concerning.
All right, we'll just wait for CT. I'll come with as well. Right. All right, cheers. The great thing about getting to CT is that you get some answers to the questions. Yeah, let's roll. The problem with going to CT is that you're away from the safety of the emergency department. So you're going there with limited resources, and it's quite scary when somebody's unstable.
You've done a pretty good job of breaking both your arms, and we think a couple of bones in your pelvis, but we're just going to get a CT scan, okay?
He can't remember the actual accident itself, and he can't remember us telling him over and over again. He doesn't know where he is, he doesn't know what's happening. So I think he forgets like every 15 minutes.
How bad is it? Tell me.
Well, we're just getting the scanner right now, right? So we'll find out very soon.
Hello, Michael?
Yeah.
G'day, my name's Dan, one of the radiographers. All right, just keep nice and still.
We're scanning from his head down to his hips, and we're doing something as well called a CT angiogram, and that involves us giving an injection of contrast dye. That will highlight all the veins and arteries so we can see if there's any bleeding, any leaks inside of him.
Really done the brain yet?
Dr. Terry's worst fears are confirmed.
Yeesh. Yeah. He does have a bleed in the brain. He's got rib fractures, both sides. He's got some spinal fractures, he's got a sternal fracture, he's got some pelvic fractures. He's got a acromion fracture, which is part of his scapula into his shoulder. It's mangled. And he's got the wrist fractures as well. That would hurt so much. He's broken nearly every bone from the shoulders to his pelvis. Transfer on 3, 2, 1, go. That's it, nice and slow. Beautiful. How's your pain doing?
Pain is tolerable.
Good. Yeah, sure.
Suddenly, Michael's in serious trouble.
He's just got a blood pressure of 89. I'm recycling it.
Sure, okay, that's not a good thing. His blood pressure has now dropped. He's now become less stable than he was before. Now I'm terrified. All right, we should probably get him back as soon as we can then.
Yeah.
Let's go back now.
Yeah,
Should
let's
we
go back. If you take the airway bag, I'll get the map.
That's fine, let's go. The worst case scenario is coming to light. We need to get him to trauma as soon as we can. We need to be able to stabilize him as fast as possible. Go, go, go. If his blood pressure drops any further, he can arrest and die.
"18-year-old rugby league player Katu is struggling to breathe after collapsing during a game of rugby.
I don't like all this high respiratory rate distress. It might be better to tube him, but then there's the risk of the neck, right?
Yeah.
The act of intubating, so putting the tube through, may actually move someone's neck unless we do it super cautiously. So I'm just weighing up what's the best course of action here. Is he safe to go to CT the way he is?
A CT scan will reveal if the game he loves has changed his life forever.
So I think he's got a high spinal injury.
Yeah.
We're going to go now,
Yeah.
and then we'll make a diagnosis, and then we'll all be happier.
Okay.
My name's Megan. I'm with the other trauma doctors. Have you got family, buddy? Yeah, you're home with mum and dad still? Yes. Yeah. Try to keep your head nice. You've got 25 minutes now.
Katu's dad and family are anxiously waiting to see him.
Pretty scary time for us as parents. We're still trying to get our heads around it, so yeah, it's just so random. You know, it's been really overwhelming, and he's just a great kid.
We're going to go to CT. We're not going to tube him. We're just going to go like this, and we're going to get some information.
The CT scan will be a nerve-wracking few minutes for Dr. Jonathan.
So I think he's got a broken neck, so just be very careful. We're all thinking spinal injury, and I guess it's one of those things we don't really want to say because it's just so horrible to think about. But that's what's on our mind. When are we going to see that fracture, and how bad's it going to be, and what will it mean for this poor guy?
And on 3. 1,
Nice and gentle.
2, 3.
It's still cycling.
That's not a good thing.
No.
24-year-old motorbike rider Michael is being rushed back from CT after his blood pressure crashed.
I'll take another VBT, make sure his HB hasn't dropped.
Oh my God, that's so much pain.
Do you feel dizzy at all?
This is my hand, it's in pain.
Your hands
Yeah,
are in
I know,
pain.
buddy.
Oh God.
With critical injuries and a brain bleed, he's going rapidly downhill.
What's it? Is he acidotic? Let me just have a
Yes.
look. Yeah, that's not good. His blood is more acidic than it was before, which is a sign that he doesn't have enough blood in him. So we have to give him more blood right now. Give him a unit packed red cell stat now.
Yeah.
My arms are suffering.
I know. We're getting some painkillers right now, okay? His pain is out of control, so we need to be able to give him some morphine, fentanyl, ketamine, which he's having an infusion for now, and we're still struggling to get on top of it. Can we pull that up? There we go.
Oh my God, physical pain.
Just give me something for the pain right now, okay? Starting with 50 of ketamine.
Gonna make you a little bit sleepy, buddy.
He has broken wrists and forearms. The concern is that he's causing damage to his nerves and his arteries. So what we need to do is sedate him, make him nice and relaxed so we can pull it back into place and keep it that way. Is everyone ready to go?
Yep.
With Michael sedated, his right wrist is straightened and plastered.
Good job, very quick.
The team can now work on cleaning and immobilizing his other arm.
He has an open fracture on that side, which is much more concerning because you can get an infection within the bones themselves. So we wash it out as best we can and then put a plaster cast over it.
Ready, set, go.
Michael's fractured pelvis puts him at high risk.
Well done, well done.
You can bleed out from your pelvis if there are broken bones there. So a binder keeps everything nice and tight so it minimizes the amount of blood that can be lost.
I can't move. I can't move.
All right, buddy, what's going on?
I can't move.
You've had a motorbike accident. You need to stay as still as you can, okay?
Ow.
Could do with a bit of help, yeah. Just rushing to get somebody now. I'll be back in just a sec.
Yeah, of course.
This man is in extreme agony. I'm really struggling to control his pain, so I need more senior support to figure out how else I can solve this issue. There's so many teams involved, so yeah, just trying to figure out how to manage him.
For such a complex case, Dr. Terry calls on the experience of emergency doctor Martin Dutch.
He's in loads of pain, he's writhing around. I don't really know what I could do for him.
Let's go to bedside and put him out of his misery. All right, let's do it.
I think he's got a broken neck, so just be very careful.
Just 90 minutes ago, 18-year-old Katu was happily playing rugby league.
You're going to be fine. Hang in there.
Now, he's about to be scanned for a life-changing spinal injury.
We are very anxious that we might see something catastrophic. So I'm kind of preparing myself for a nasty spinal injury and then all the things that flow from there. It's just a heart sink moment when you see someone with a broken neck. So I'm hoping I'm not going to see that. These are the ribs. Normal. Okay, this is his back. Normal. That's his aorta. Sometimes it gets an injury to it, but that also looks normal. Good. So I don't see a broken neck. I don't see any injuries at all, really. We're clueless still. It actually looks all right. So from my quick side-on view of Katu's neck, I'm not seeing a fracture. Now, we'll have to go through in detail, but grossly things look like they're in the right spot. So that's a relief.
Katu is not yet in the clear. Dr. Jonathan needs to know why he lost consciousness and is still struggling to breathe.
Could it be that he just was winded, got the CPR, hurdled his ribs, hurt his back, just to sort of breathe? Could it be that? Pretty extraordinary. Sometimes things are easy, right? Sometimes they're not easy. Tuesday afternoons, it's not easy. This guy's challenging my clinical acumen. Why does it hurt? He's only young, right? So he could get one of those weird spinal cord injuries without a fracture. Yeah. If you're younger, you can actually bruise and hurt the spinal cord without having a fracture. And the CT won't show us that. So we're not out of the woods yet.
Keeping Katu's sore neck stable is the team's highest priority.
Better tell him and his family what's going on.
We're just gonna bring it in a minute.
After an agonising wait, Katu's family finally gets to see him.
Don't worry about that now.
Yes.
Don't worry about your clothes or anything. It's a bit hard to see him with monitors and everything cut off him and that. It's not what you really want to see your child, you know, so it's pretty tough. We wish this on no parent to have to go through what we've gone through. That's not good.
Going to MRI.
Dr. Jonathan organises further scans to try and figure out what's going on.
An MRI, that will be the test that will show us what does his spinal cord actually look like. We're not actually seeing any injuries. He's still got the weakness and we still don't really know why he had the chest pain and the collapse. So there'll be an answer and time will tell. But at the moment, we're not there. He's not out of the woods yet.
For now, Katu leaves the ED to have more investigations and wait for the results. It's been an unusual journey that led emergency nurse Peretz Kutnik to Royal Melbourne Hospital.
I come from a family of rabbis. My grandfather was a rabbi, my father was a rabbi. I actually went overseas to start religious studies to become a rabbi. While I was studying, I did a paramedic course, worked as a paramedic. And when I came back to Australia, I decided I wanted to do nursing. To make a big difference in somebody's life is huge.
The entire ED team make big differences in the lives of people.
Well, I'm receiving.
Every hour of every day.
Coming to you with a 55-year-old male with a left arm crush injury. Was trapped in a car wheel, which is now of severe pain, done this with tingling, altered sensation and swelling to the left forearm down.
Less than an hour ago, admin worker Gavin was alone in his backyard when the car he was working on fell and pinned his arm.
Hi, Gavin. I'm Peretz. I'm one of the nurses. There's going to be a few of us here as well, OK?
Ready, set, go.
Is that the sore arm, the left one? Yeah.
So this is Gavin. Gavin's been changing a car tyre when the jack has slipped and his left hand has come entrapped. Trapped for approximately 10 minutes when neighbours have come to his aid and lifted the car.
Well, I was in my backyard. I heard a crash bang and the next minute Gavin is yelling out, "Peter, Peter, help me." So I whizzed around and the jack had collapsed. I quickly got 3 other neighbours to lift the car up so we can get his arm out.
If I didn't have people next to me, next door neighbours, I would have, I think, passed away tonight. I couldn't get my arm out.
Losing the use of his left arm is especially frightening for Gavin.
I can't use my right arm in any capacity. I can't even do my shoelaces up and recognise that I'm a minimised survivor, which makes it very, very hard to use that arm.
Gavin's mum took the anti-morning sickness drug thalidomide.
Doing really well, Gavin.
The notorious drug caused severe deformities, and Gavin's right arm was badly affected.
If I lose my left arm, it's tragedy.
Can you make a fist for me on that side? You can't. Can you feel me touching? It's reduced sensation, is it?
The seriousness of Gavin's injury has meant trauma surgeon Dr. Rose Shakirian's been called to assess the damage.
On that side for me. Are you able to straighten your elbow?
As Rose is examining Gavin's arm, he can't move it, he can't feel properly, he's got decreased sensation.
What happens if I move it? Does it cause pain?
As I'm hearing these constant problems with Gavin's left arm, alarm bells are going off in my mind. I'm thinking, have nerves been affected? Has muscle been affected?
Are you able to move your fingers? Alright. Can you squeeze my hand?
We know there's been a crushing injury. We know that there's been something serious. How bad is this?
I'm trying to move this arm.
Try not to move it, buddy.
G'day, mate.
Move your arm.
You're sore, are you?
Very.
Very sore.
A serious motorbike accident has left 24-year-old Michael with multiple broken bones and a bleed on the brain. Dr. Martin's assisting Dr. Terry to get his extreme pain under control.
What's the most sore thing?
This arm.
The left arm.
Right.
One of my jobs as an emergency physician is to train and mentor young specialists in training.
How much opioid has he had?
He's had 200.
200 of Fent.
We're going to get rid of your pain. Going to get rid. Yeah, that's all right. Let's start working on it. I'm going to do a nerve block on this man.
They need to take the plaster off so Dr. Martin can access his veins.
Michael's got a severely fractured wrist, so I'm going to inject some local anaesthetic.
Little sting.
Just below his elbow to make his wrist numb.
Ow.
You sore up here?
Ah.
As I'm moving Michael's arm, his elbow is not moving normally and it's quite uncomfortable for him. And that makes me worry that there's something going on with the bones or joint in his elbow.
So that's wrapped in local anaesthetic, which is good. He's snoring now.
I know. We had to sedate him to do it before.
Well, he's had 20 ketamine and now he's had some more local anaesthetic block and now he's asleep. That sort of says to me that perhaps this is effective.
Traction, traction.
Yeah. Yep. I'm pulling.
Yep.
With the anaesthetic working, they can reset his arm.
Are we going for pain?
Yeah, he's okay.
Yeah.
Like, he couldn't tolerate this at all earlier, so, like, he's doing really well.
Magical.
Worried about unexplained pain in Michael's upper left arm, Dr. Martin wants more investigation.
We need to check out what's going on in that elbow.
We're nearly done.
His elbow's actually dislocated. It's popped out and gone back, and I think there's a little chip, maybe a bit of a broken bone as well. Explains very much why it must have been complete agony for him.
Sorry, darling. Sorry, who are you? Are you his mum?
Is that Mum?
That's okay.
Yeah, she's right here, buddy.
Mama.
Okay.
Yeah, Mike.
Yeah, come on.
Yeah.
Of course.
Michael's mum, Michelle, arrives, unaware of his shocking injuries.
Hey, Mish. I'm Terry. I'm the doctor. You okay?
Yeah.
It's right. Slow down. It's okay. So, look, it's going to be a long road to recovery.
Yeah.
But he's going to be fine, all right? Okay?
Fighting every motherly instinct to stay with her son,
We'll get you in as soon as we can, okay?
Michelle has to leave him in the hands of the doctors.
It's heartbreaking, you know. As a mum, you don't see a 25-year-old man on that, you know, on the hospital bed. It's like your little 5-year-old boy.
You've gone and popped your elbow joint out.
Oh, lovely.
Yeah. Do you want me to pop it back in for you?
Knock me out, pop it back in, should be right.
All right. Just slowly start moving it.
Yeah, sure.
So bring it into 90 degrees. Yeah. And push from behind up.
Oh, there you go. Got it.
Well done, team.
Thanks.
So the good news is at the end of your shift, after managing this patient from beginning to end, you are an emergency physician.
Oh, great. That's good to know.
This man has given you every problem to solve.
Michael's case is the worst motorbike accident I've ever seen. He's going to be admitted to ICU. He's going to require at least one procedure, if not multiple, and he's got a long road of recovery because there's going to be probably lots of issues with pain, mobility, and just getting him back to where he was before.
Saw there, Gavin. Yeah. Do you remember what happened today?
55-year-old Gavin was changing tyres on his car when the jack slipped, pinning his only good arm.
I had my fingers amputated when I was a child.
Yep.
So it's not in mind.
Gavin is in serious pain, and Nurse Peretz needs to control it with intravenous drugs. But there's a problem.
So I can't get access on the right side.
Oh, why?
Just nothing's showing.
We're struggling to find a vein. It doesn't allow us to administer quick pain relief to Gavin, which he desperately needs.
An ultrasound eventually shows a vein.
Okay, sharp scratch now, okay?
Doing really well, Gavin. How's the pain? 6 or 7 out of 10. We're going to do an X-ray and make sure everything's okay there.
The X-ray will reveal if 10 minutes of crushing has broken any bones in Gavin's arm.
He's just feeling a bit colder on the left arm and leg.
Does he have C-spine tenderness?
No.
It doesn't look like there's anything broken there. I think you've damaged the muscle.
With the team still worried about the danger to Gavin's arm, emergency doctor Luke Delarue steps in to help.
Hey, Gavin. How you doing? I'm Luke. I'm one of the emergency doctors. I'm just going to have a quick look around, all right? Is it sore in through here?
The reduction in movement of Gavin's hand and the reduction in sensation tells me that there's been significant damage to the forearm. It could be direct trauma to the nerves that supply the function of the hand. It could be stunning of the nerves from the pressure in the wrist and the forearm.
What other medical issues do you have?
thalidomide survivor, so...
Thalidomide, okay, yeah.
So I have my right arm in the hand.
Yeah.
Okay, chest and internal injuries.
Okay.
And the heart too.
Did you have any chest pain or racing heart?
Chest pain on the left side.
Uh-huh.
Numbness with the arm.
Yeah.
All the way through.
Was it above the elbow or above the level of injury that you had numbness as well?
Shoulder down.
One of the things we worry about with crush injury involving a large amount of force or a prolonged period of time is something called compartment syndrome. It's where there's swelling within the soft compartments of the limb. It's a limb-threatening injury, and that can actually develop into a life-threatening injury as well.
Yeah. Has that gotten worse or is it about the same?
Around the state.
Dr. Luke is with thalidomide survivor Gavin, who is still in a lot of pain after his only good arm was crushed under a car.
It's going to be pretty sore because there's at least a big hematoma or bruise in the muscle.
No break, no.
There's no big break that I can see, which is good. Can you wiggle your fingers for me again on this side?
Very sore.
In order to identify if a compartment syndrome is developing, we need to watch over a period of time. What Gavin really needs is a CT scan to make sure that there's adequate blood supply getting through the region of injury and down to the hand.
Resus 3 needs a pretty urgent scan for the chest and arm because of compartment syndrome.
Gavin's wife Lisa and neighbour Peter are waiting to see him.
So we're going to do a CT scan of both the chest and the arm because it's some chest pain as well, and just make sure everything is okay. So we'll know a bit more after that. Nothing's broken on the X-ray.
Lisa's here.
Yeah.
I tried to do myself swim. My arm get caught and I couldn't move with my right arm.
You won't be changing any more tyres.
No way. I'll never change a tyre again. I've learnt my lesson. Thanks for saying my life. That's right.
Come on, Sam, you're going for a CT scan, okay?
A short ride to the CT scanner will go a long way to answering the team's concerns about Gavin's injury.
So the left arm is the problematic one. Thanks, everyone. See you.
Dr. Luke gives Gavin the news he's been desperate to hear.
So look, the scan of the chest looks okay. There's no injury to the vascular structures or the blood vessels, which is good. We were worried about that given that your arm was kind of pulled and trapped. And the plastic surgeons don't think that there's a compartment syndrome, but they want to just continue to monitor that. And I'll put a cast on as well just to keep it nice and still.
Okay.
It helps with the swelling.
Over a period of time, that big bruise within the muscle belly will improve, and hopefully Gavin should return to full use of that arm, which is really great.
How's the pain?
It's probably back to 5 now.
Yeah.
And I'm not getting the numbness anymore.
Yeah.
And I can do that.
Good. Are you able to straighten through the elbow?
Just sore here.
Yeah.
Treating a case like this with Gavin is definitely one of those positives we talk about.
Is that comfortable enough?
Yeah, that's
To see Gavin's face change from fear to elation when we tell him that we think his hand is going to be okay. It's a great part of your day.
It's unlucky.
Gavin's been given the all clear, but he'll still need to be kept in overnight for observation. Deputy Director of Emergency, Dr. Steve Pincus, is responding to a call for a patient with a serious heart condition. 61-year-old Richard has just been rushed in by ambulance.
Richard, good day. Steve's my name. I'm one of the doctors. How are you going?
Yeah, sort of okay.
So tell me a story. What's going on?
Today I woke up okay.
Yep.
Got dressed, I was going to do some exercises. Started not feeling 100%, so I stopped. Heart rate was at 69 and then accelerated up and settled at 120.
Richard has a very fast heartbeat. It can deteriorate into a more dangerous rhythm, and because the heart's working so fast and so hard, this could precipitate a heart attack.
The retired Human Services Manager has been brought to the ED with frighteningly fast heartbeats 3 times before.
Get a bit of a flutter in the chest, and that's the heart not beating correctly. And then the pain starts as the heart rate speeds up, it's going a lot faster than it should, and that hurts. If I don't monitor it and it gets out of control, the heart can stop beating. say, drop dead on the spot.
Richard's heart is still racing at more than twice its normal rate.
I can see that Richard's heart is beating very fast, but I can't tell, is this atrial fibrillation or a very similar and related condition called atrial flutter?
We'll take some bloods.
Yep.
Do an ECG.
Richard regularly sees a cardiologist at the Royal Melbourne.
I'll talk to John Coleman, and my suspicion is he'll say, do we mind doing a zap and trying to get you back into sinus rhythm?
Yeah, that'd be nice.
Sinus rhythm is the normal heart rhythm. What we're trying to do is reset the heart rate back to normal.
The procedure, called cardioversion, involves sending an electric charge through Richard's chest. But first, Dr. Steve needs to find out if Richard's heart is an atrial fibrillation or atrial flutter.
Between the top of the heart and the bottom of the heart, you've got a junction box. Yep. So what we're going to do is I'm going to give you some medication which, for about 10 seconds, it completely blocks conduction in the junction box.
Oh, okay.
Dr. Steve will stop Richard's heart for a few seconds so he can check its electrical activity and see if it's got an irregular beat called a flutter wave.
If that shows the underlying rhythm is flutter, then we'll pop you off to sleep properly and give you a zap.
Yep, no worries.
Okay. Let's find some bodies to give us a hand.
The critical nature of the procedure means emergency nurses Jenna Orman and Liz Wheeler join the team.
Now, Richard, you share with me, you wear the full bear suit.
Shave away to your heart's content.
We're going to give him a medication called adenosine that temporarily blocks the conducting system of the heart.
It's going to give you a little bit of sedation now, okay?
The heart literally looks like it stops beating. Then as it recovers, we can see if it was what we call flutter.
You right, Richard?
Let's do
okay,
it.
so let's start with 6.
Adenosine 6 going in.
It's a nervous moment as Richard's heart slows and stops.
There it is. It's flutter.
Yeah.
When I've stopped Richard's heart, it feels like time has stopped for me. I'm anticipating what's going to come next.
Yeah, he's gone straight back into it. How you going there, Richard?
Weird.
Not too terrible?
Not too bad, not too good, but yeah.
Yeah, okay. Gone now?
Lessening.
Yeah, good. Okay. So that confirmed exactly what we thought. You have a flutter wave underneath.
We now need to go on to sedating him and, in layman's terms, zapping him to put the heart back into a normal rhythm.
Okay, everybody's ready?
Yep.
Richard, you know you understand what we're doing?
Every time you sedate someone, every time you zap someone, you have in the back of your mind, what if something goes wrong?
Starting to feel a little bit tired there.
You're taking someone's life in your hands, effectively.
So we're going to give you sedation. You'll get that garlicky taste in your back of your throat and that slight sort of sting in the arm.
50 of propofol.
Sedation is by far the most significant risk here.
Starting to feel a little bit tired there.
The risk to his airway and his breathing.
How you going there, Richard?
Happy?
Yep.
It takes only a few seconds for the machine to ready before it delivers a precisely timed shock.
Yep.
It's
Good.
synced.
Good, thank you.
Charging.
Okay.
Stand
Yep.
back. Shocking.
Flutter. Back to sinus rhythm.
Our heart rate stops a little bit.
I think he runs a pretty low heart rate normally.
The electric shock works. Richard's heart has gone back into a normal rhythm.
Beautiful. Let him wake up and see if he's going to stay in it. Oh, Richard, big breath.
Richard, can you hear us? He's still breathing.
Richard's taking longer than usual to wake up.
It's just shallow.
Richard is not breathing as well as I feel he should be.
I think he is very sensitive to medication. No, he does obstruct.
Still requiring a jaw thrust.
And finally,
How you going, Richard?
he's breathing.
Good stuff. Make sure we'll put a note in his history for future.
Yeah, but he's very sensitive. to
Very
medication.
sensitive to sedation, yeah. Richard has some underlying damage to his heart muscle, and that makes him much more prone to, in particular, atrial fibrillation, but other arrhythmias. And so I expect this won't be the last time he needs to be defibrillated.
But for now, Richard's heart is back in rhythm.
Oh, a hell of a lot better. It feels, with the heart now back at a fairly normal heart rate. There's no pain in the chest. I don't feel unsettled. And, it's back to normal. So, time to go home.
Schoolboy Katu collapsed on the rugby field, suffering breathing problems and chest pain.
So suspected spinal injury, just be careful.
Dr. Jonathan was concerned the 18-year-old had broken his neck.
Very worried about this boy.
The CT scan cleared Katu of a neck injury, but didn't solve the mystery as to why he collapsed.
This guy's challenging my clinical acumen. Why does it hurt?
It's just good to see you up and about, and hopefully we can get the answers that we need.
Katu was sent to a ward for further investigations. He spent 3 days in hospital and continues to have tests. Katu's hoping to be back playing rugby with his mates very soon.
My biggest worry is hopefully getting this sorted so that I'll be able to go back to sporting and be able to do the things that I love to do.
Hi, Gavin. Is that the sore arm, the left one?
Gavin's left arm was crushed by his car when the jack slipped as he was changing a tyre. The thalidomide survivor feared losing the use of his only good arm.
It's fine, but does it cause pain?
CT scans showed acute bruising with no permanent damage. Gavin spent a night in hospital recovering.
I can move my fingers now and there's no tingling, and about 90% back to full use, which is amazing.
The 55-year-old has promised his wife Lisa he'll never change a tyre again. 61-year-old Richard was rushed into ED with a racing heartbeat.
There it is. Next flutter.
Dr. Steve diagnosed his heart as being in atrial flutter.
Charging.
After being sedated, Richard's heart was shocked back into a normal rhythm.
Shocking.
And he was able to go home the same day.
1, 2, 3.
24-year-old Michael suffered multiple fractures when his motorbike slammed into a van.
Pelvic fractures? Oh.
CT scans also revealed a bleed on the brain.
Yeesh. Michael's case is the worst motorbike accident I've ever seen.
Michael had many operations to fix his broken bones and is now back at home being looked after by his mum.